Hello everyone, this video is about managing clients with hallucinations. When persons hallucinate, they perceive something in the absence of stimuli. Hallucinations may be visual, auditory, olfactory, gustatory, or tactile. Despite the absence of stimuli, the perceptions are very real for these clients. What are the causes of hallucinations? First is the failure in the censorship mechanism in the brain. It is postulated that there is a censorship mechanism in the brain which actively excludes from the consciousness the majority of information that we receive through our senses. Think of it as a filter. Not all of the information that you receive through the senses will reach your consciousness. You are not going to be aware of a lot of this information because the brain is selective. But when the primary sensory cortex, which is the part of the brain that is responsible for processing sensory inputs, gets dissociated from the sensoring mechanism, then this mechanism fails. Another reason why this censorship mechanism can fail is because of sensory deprivation. The censorship mechanism can operate only when there is a constant flow of sensory inputs. But if by any chance there is a stoppage or impairment of sensory input, such as what happens when there is sensory deprivation, then this censorship mechanism fails. So what would be the effect of this? Earlier perception or memory traces emerge into the conscious and the individual experiences hallucinations. This is evidenced by an experiment that was conducted wherein healthy college students were confined in a small cubicle. They were made to stay there and they can leave the cubicle only to eat or to go to the bathroom. They lie down on the bed and they wore goggles which were translucent in order to filter light so they would not see any images. Soon after this, they developed hallucinations. Remember, they started as healthy college students, but they still develop hallucinations because of sensory deprivation. Another cause of hallucinations is decreased acetylcholine. Evidences? First, hallucinations are present after belladonna intake. Belladonna is a plant that contains atropine, scopolamine, and other anticholinergic agents. Anticholinergic means against acetylcholine. They decrease the level of acetylcholine. Another evidence is that 60% of patients with Lewy body dementia and 30% of patients with Alzheimer's dementia experience hallucinations. Both of these conditions are characterized by a reduction in acetylcholine. Another cause of hallucinations is increased serotonin. Evidence is that hallucinations are related to the intake of LSD or lysergic acid diethylamide, mescaline, and ecstasy. These are hallucinogenic drugs and they appear to act as serotonin receptor agonists or partial agonists, which means they increase the level of serotonin in the body. Another cause of hallucinations is structural changes in the brain, particularly in the superior temporal gyrus, prefrontal cortex, and cerebellar cortex. These are demonstrated by imaging techniques. In schizophrenia, there is evidence that very high levels of dopamine in the limbic system play a major role in the emergence of hallucinations. This could be the reason why drugs that reduce dopamine are able to control the symptom. And for this reason too, the use of antipsychotic drugs is the cornerstone of the management of hallucinations. But for this video, we will be focusing simply on non-pharmacological interventions. So how do we manage clients with hallucinations? First, watch for hallucination indicators, such as appearing distracted, or suddenly stopping a conversation, or intently watching a vacant area, and muttering or talking to oneself or to someone who is not there. Now, if you're suspecting that client is having hallucinations, then validate. Example, you can say, "You look as though you are hearing something." Ask about the content of the hallucination but do not refer to the hallucination as if it was real. For example, if a client says, that he hears voices, then asks, "What are the voices saying?" And then the client says, "The voices are saying that all of the hospital staff will be killed by midnight." Do not follow that up with "That's scary." Because if you say that, then you are communicating to the client that the hallucination is real. Assess the client's reaction to the hallucination. Is the client showing fear, anxiety, or distress? And if there is a command hallucination, is the client trying to resist the command, or is the client agreeing to the command hallucination? So, what is a command hallucination and how is the client reacting to it? This is a very important assessment area because many command hallucinations will tell the client to harm someone, such as himself or other people. Therefore, it is important for you to know what is the content of the command hallucination and how is the client reacting to that command. Do not try to convince the client that hallucinations are not real. Instead, present your own perception. Remember that for the client, this is reality. So you wouldn't be able to convince him. Don't say there are no angry voices. Instead, say, "I don't hear any angry voices." There's a big difference between these two responses. The first response is saying that what you're experiencing is not true. The second response is simply saying that "I am not experiencing what you are experiencing." Show empathy for how the client is affected by the hallucination. For example, say, "I don't hear any angry voices, but I can see that the voices that you hear are making you frightened. The voices are not real, but the feelings are real." So, give recognition to that. Promote reality testing. Encourage the client to consider that what he or she is experiencing is a hallucination by promoting comparison of perceptions with those of others. For example, you can say, "You hear angry voices, but I don't hear any. Look around you. Do they seem to be hearing angry voices?" Focus on reality-based activities, such as safe, easy-to-do projects, conversation, walking. All of these are focused on reality and on the here and now, and this will help the client get distracted from the hallucinations. This will also give the client an opportunity to be more connected to reality. Promote safety. Hallucinations may cause anxiety that may affect judgment on what is safe or unsafe. For example, if the client has a visual hallucination of someone who is about to attack him, then since for him this is very real, then he would do everything in order to escape that attacker, unmindful of his own safety. And he may hurt himself or other people because of that. Command hallucinations may cause clients to be suicidal or homicidal. They hear voices telling them what to do, and they may obey these voices. Therefore, prevent self-inflicted injury and prevent violence directed to others. The most basic interventions specifically directed to these risks in response to command hallucinations are monitoring and environmental control. The patient should be monitored, be aware of what they are doing and where they are, and control the environment so that the environment will be free of anything that can be used to harm other people or self. We also need to teach clients how to manage their hallucinations. First is manage stress. Why is this important? Because stress can make a person vulnerable to hallucinations, and stress can also exacerbate the symptoms of schizophrenia. You may refer to this video for tips on stress management. Just click the link provided. If the client has auditory hallucinations, then teach the client to listen to other sounds that can compete with hallucinations, such as listening to music, TV, or conversation. Teach the client to do reality testing. Tell the client, observe if others seem to be seeing or hearing what you see or hear. Or ask trusted others if they are seeing or hearing what you see or hear. So that means that you are teaching the client to doubt the reality of what he is seeing or hearing because he is getting input from other people. Finally, Tell the voices off. There's a client that he can say to himself either aloud or if there are other people around him and he does not want other people to hear what he's saying, he can say this in his mind. The voices are not real. The voices cannot harm me. Go away. Go away. So these are the techniques for managing clients with hallucinations. Please click the subscribe button and also like this video.